Some local and state officials have voiced concerns that the COVID-19 vaccine is not being distributed equally to all ethnic groups. Why are they concerned? Find out on Talking with Henrietta, coming up next. Today, I have 6 guests with me, and we'll be addressing the concerns related to the COVID vaccine rollout. I'll be talking with East Palo Alto City Council member Antonio Lopez, State Assembly member Mark Berman, the CEO of the Ravenswood Family Health Network, Luisa Boada, the Ravenswood City School District Trustee, Anna Maria Pulido, State Senator Josh Becker, and Pastor Paul Baines. So I'd like to start our discussion with the question of why is it that we always seem to have equity issues when it comes to various groups within our community? And right now, with the COVID vaccine that's being distributed, why is there any question at all about equity? Don't all answer at once.
Well,
I'll jump. Oh, Anna, please go ahead.
well, I mean, just to start off, and this is just, I think, one of probably several reasons we can mention. I think when you don't have representation on a decision-making level, it impacts the way decisions are made and how strategies are planned and what the rollout is of any given situation. And I think this is a reason why it's important to look at who's at the table and who's missing from the table, and creating a environment and a culture of welcoming voices that are not currently represented at all levels. And whether that is at a local city level, whether that is at a county level, state, and so forth, national. I think it's about inclusion, intentional inclusion, and inviting new perspectives, diverse perspectives, and creating a welcoming environment that allows for those conversations to happen, and just creating that level of inclusion for all groups. That way, communities like East Palo Alto aren't forgotten. That way, communities like East Palo Alto are always a priority and not an afterthought. So
Okay,
that's how
Anna,
I'll kick
thank
it
you
off.
so much. Now we have 2 decision makers with us, State Senator Mark Berman, State Assembly member, I'm sorry, State Assembly member Mark Berman, and State Senator Josh Becker, your decision makers sitting at the table.
Yeah.
So is it within your reach to make sure there's equity on some level?
Yeah, so it's been a really hard, and it's been a really frustrating few months, I know, for many of the residents and for many of ourselves. And it's, the facts have just been so clear, right? East Palo Alto, 1 in 6 have gotten the virus. That's total population. So that means probably 1 in 4 or 1 in 3 adults. And it's clear why, right? That the community has been, many of our frontline, many of the frontline workers that have kept the whole area going during this year-long pandemic. I can't believe it's been a year. It was, exactly a year. And, East Palo Alto residents have been, many of them have been on the front lines. And that's why, and that's clearly why the cases count is so high. And so I think many of us said, if this is the case, if the cases are there, let's get the vaccine there. And it's been hard. And Louisa, I'm sure will will kind of fill us in on all the details, because she's sort of been the behind the scenes. I mean, she's the one responsible for the vaccines that have gotten out into the community. And she can really tell us sort of the behind the scenes and what's been going on. But it's been difficult at all levels. And it was complicated by a vaccine that, had the Moderna and Pfizer, that both had high storage, very complicated storage requirements. But I remember early on at Stanford Hospital, people telling me, hey, the folks that we're seeing in the hospital many of them are from East Palo, many of them are from East Menlo Park. We'll get the volunteers there, but we got to get the storage, we got to get the vaccine, we got to get that there. But I know there've been a lot of efforts at the county level, and I'm really gratified to see what's happening next week. They're shutting down the mass vaccination center. They just announced for a week or two to just really focus on communities like East Palo, which is great. I think that's exactly what needs to happen. I think, Mark and I have both been advocating at the state level, sometimes with more success, sometimes with less success. Frankly, it's been a little frustrating. Even, we had a couple frustrating calls with the governor's team. Even though he's in the Bay Area, when he came out, we made a big push for a prioritization plan, equity prioritization, and we got an equity prioritization plan. The only problem is the equity prioritization plan really didn't prioritize our communities for the wet.
Okay, so let's have Assembly Member Berman comment in terms of this prioritization and what's going on.
What's going on is very frustrating. The metric that they've created. And first, I totally agree with Ms. Polito's comments. We need everybody needs to be represented at the table. So we know things like if you have to sign up online to get an appointment, that immediately makes it much more difficult for certain communities and certain constituents that we have. All those things really should have been thought out a little bit more before we lent so much weight to those ways to sign up. But the prioritization leaves out East Palo Alto. It leaves out in Josh and my district, Belhaven, North Fair Oaks, Pescadero, East San Jose, which isn't in our districts, but it's in the Bay Area, because it uses a metric that takes into account zip code instead of census tract. And when you do things by zip code, that means that East Palo Alto gets included with Palo Alto. That means that Belhaven gets included with the rest of Menlo Park, North Fair Oaks with Redwood City. And that's inflating the numbers and making it look like things are better than they really are in communities that are. East Palo Alto is in a different city and a different county than Palo Alto.
So you talk about how things should have been thought out, and somehow it always ends up this way, where people would say, well, it was thought out, and it wasn't thought out with the consideration of those who are most vulnerable in mind. It was thought out for those who were within the interests of those who are the most affluent, and let's say at the top of the pecking order. Is that right?
That's a point.
I don't think that's quite fair. I mean, what came down from the state, and this was the issues, they said we're going to go by age 70. So first health workers, then 75 plus, then 65 plus. And the county, said, okay, we're going to do what the state says, which we're going to do 75 plus and we're going to do 65 plus. And so even though, many of us were yelling, hey, let's look over here, they were following sort of the state guidelines. Now, I think once it opened up, then it became even more clear, okay, we got it, let's get out to this community. But I'd love to hear Luisa's perspective. I mean, you've kind of been on the front lines of this, and I think she's probably the best person to sort of talk about the, behind the scenes. Because I was talking to Supervisor Slocum today, who's been advocating, heavily, and luckily there's a good plan next week, but just telling me about all the complications and why it's been so hard. And Luisa, I don't know if you have any.
Okay, now before Luisa talks, I'd like to hear from City Council Member Lopez, because I'm sure you have some thoughts in terms of the pecking order and whether it was well thought out with others in mind.
Yeah, absolutely. Thank you. I'll be brief, Lisa. So I want to make sure I want to hear your advocacy as well. Part of the issue, in my opinion, is this is a virus that we've had to turn on a dime from the local level, the federal level, the state level. What you had was a philosophy initially from the government was we just need to flood the air with the vaccines. Velocity was the focus. But in the middle of that, there was sort of this aha moment that people had was, wait a second, what if being quick about it isn't a solution? Because if you're quick about it, you don't keep in mind, again, the differential impacts of COVID, that some folks are, as Mark Berman and Becker say, that, and believe as well, you're asking somebody to spend a whole day waiting in line. You might be in a home taking care of a kid. You may not be able to ask for a day off at work, right? Those local nuances, and because you have, I think it's just an issue of federalism, frankly, that when you have the scope and scale of a wartime idea of getting this vaccine in the turn of a matter of few months, inheriting an administration which had its issues, deficiencies, you're working with all capacity. And it's not being apologetic to the state level. I'm advocating first and foremost for my community of East Palo Alto, but I do understand that there is a little adaptation and a change of strategy that happened midway. And I have much empathy for the idea that only 2%, and when Governor Newsom announced that the 40% of the vaccines are given to low-income areas, only 2% was Bay Area. So trying to stretch 2% of a supply is really difficult. And so how are we ensuring that we have the ear of the governor, the ear of folks who have that conscious mindset that it's not enough to sort of give it 50-50. You have to undo decades of structural inequalities that are manifesting in this very moment. We share a zip code. The health index in San Bernardino is seen as lower. And so it's oftentimes a numbers game. And in that numbers game, we lose the humanity that we as local leaders see. And so does Assemblyman Berman and Becker, that they get to see, and Lisa sees, and Pastor Bain sees. And so I think it's sort of that diplomacy that is part of civic engagement that we have to learn how to play as well. It's a strategy, absolutely.
So Luisa, is it a numbers game? And how are the numbers running right now?
Yeah, so it has been a numbers game. I really appreciate what all of the speakers before me are saying, because that's all part of it. It is complex. It is not a simple thing. It's not. So you've got, if you were sitting, and I think about this, if I'm sitting in an under-resourced public health system in the state of California, you're only given a few vaccines, how are you going to disperse them and not have the population, whoever feels left out, arise? Because so, if I was doing it from a purely public health standpoint, I would pick out the areas that with the highest morbidity and mortality, and the populations with the highest morbidity and mortality, and I would focus on them first. So it made sense, healthcare workers, because they're being exposed, made sense, people in long-term care facilities. It made sense, but to me, then the next step, I would have chosen, teachers, people who are essential workers on the front line selling food in places where they are in the public. But at the same time, we have fiefdoms in healthcare. And so everyone in every fiefdom is going, when's my turn? That's how the TPA, my turn with Blue Shield came up. Everybody wanted their turn right away, right now, even though some of those people have the ability to stay home, to work remotely. They're not in any danger, but they met the age group. And so everybody wanted to be first, and the governor's trying to balance, these people, they vote for me, they send money to me, these are the enfranchised people. I have to respond to everyone and make sure that I'm kind of considering every population. But that's not a public health approach. The public health approach is epidemiologically, you look at your areas where you're going to have the most contagion. With more transition, you're going to have more variants, more
So
mutation.
why don't we have top health officials at the apex of this state? So why was that not a consideration?
Well,
why? I mean, we know good and well, we know good and well the disparities, the health disparities. We knew that before the COVID came along.
Because that's not, we don't have a minister of public health over the state of California that has that power and authority to say, to lead in that manner. That is evident in some countries. We can see that in countries that have been successful in reducing COVID morbidity and mortality. It is not the reality here. It's just not. I mean, you have Sutter, you have Kaiser, you have Stanford, you have district hospitals, you have community health centers, you have private doctors, you have pharmacies, and all these, everybody wants to be part of the whole equation. That's very complicated when you also have rationing at the same time. So it's like, how do we give a little bit to everybody without thinking about So again, numbers and velocity. You know, when the governor said, I want to do 60,000 vaccines a day, he wanted 10 hubs in California that could do 6,000 a day. Well, our clinic sees 25,000 people a year, and we have to care for them for 6 days a week. I cannot take my staff and turn them over to do vaccines. I don't get any vaccines. It has to come from the county. Now, with Blue Shield coming into the picture, it's possible I might get vaccines from them. But again, if I'm not in their health index because I'm thrown into Palo Alto, are they going to, even if I sign up with Blue Shield, am I going to get the vaccines? I mean, the person I talked to today couldn't tell me if I am.
Okay, we'll talk about Blue Shield just a little bit later, but Pastor Baines, you might want to weigh in. We haven't heard from you yet. Now,
Thank
don't feel forced to weigh in.
you. No, and even as a pastor, I'll be brief, believe it or not. Because I actually agree with what actually all the speakers have said. I really want to emphasize what President Paluto started off with. To me, it's all about access, and it's access at the highest level, at the decision-making level. The old saying, if you don't have a seat at the table, then you're probably on the menu. Well, you know, Black and brown people have been on the menu here with this horrible, dreadful, I mean, everybody's been on the menu, but it's disproportionately affected Black and brown people. And so if we are not in that decision-making process throughout the whole process, not just at the highest levels, but the mid-levels, because we know things get changed mid-level, midstream in organizations, even though the leader said we're going in this direction, then it's not going to reach to those highest mortality and morbidity rates that Louisa mentioned early on, because that to me should have been the focal point of who is this going to disproportionately affect the greatest and the quickest. Then we would have been ahead of the game as opposed to being more reactive, because the process, obviously, they're doing the best they can with what they have, but the thinking part of this, the strategic part of that could have been much better. So those are my comments.
Thank you. So does having Blue Shield now in the mix, does this improve the situation? Does it complicate it? I know some officials in Santa Clara County don't want to deal with Blue Shield. The officials say we have a system set up that's working and we'd like to keep what we're doing. So where are you, Assemblyman Berman and Senator Becker? Where are you as far as Blue Shield is concerned?
So my understanding from talking to colleagues up and down the state is that in certain counties, in certain parts of the state, Blue Shield is going to add a lot of value and is going to be a big help in counties that don't have the healthcare infrastructure and haven't been doing a good job with the virus with the pandemic over the past year. That's not the case in San Mateo County, and that's not the case in Santa Clara County, where we have very strong healthcare networks and very strong public agencies. They work together. They know what communities need what, how to do things differently in different parts of the county. And so I think it makes sense that in San Mateo County and Santa Clara County, that the counties keep the lead role. And there's been some confusion. A lot of us, I was on a call with leaders from the governor's office and Blue Shield, where they said, if a county's doing a good job, we're not going to get involved. We don't want to, we want to do no harm. And so, but there's been confusion about that, especially over the past week or so. And so I think that's something that we need to get clarity on, but especially in San Mateo County, as well as Santa Clara County. Blue Shield can maybe support in some areas, but we don't need them to come in and take charge.
Senator Becker?
Yeah, I'd agree with something Berman just said, that here we do have counties and pretty robust public infrastructure. I agree with Louisa said too, as you can see, by the way, countries that have had robust public health infrastructures more broadly have done better in in combating this virus. But here in these two counties, we do have good county health offices, so I don't think we need Blue Shield, but it could add value in other parts, of the state. And And again, that's also what I told the governor very early on. I mean, again, one of the mistakes in my mind that was made is they made the decision to only give a little bit to the county, and then otherwise, go to, give to Kaiser, give to Stanford, give to, Sutter for their patients, rather than, and then having them each spin up a, mass vaccination site or figure out their own vaccination instead of just doing, vaccination, mass vaccination with the county. Now, the county should have also had a mass vaccination site in the southern part of the county earlier. And now we'll be doing that more with these mobile units and such coming up. But anyway, I guess my point is just that I think our counties here are very functional. I wish they actually had more control earlier. And so at Blue Shield, I don't think adds value here.
Sure. So Anna, is there anything that you would like to add to what's been said so far?
No, as far, I mean, we understand that there's a limitation in the way that resources are available as far as like the vaccination. But for example, when I think about Ravenswood City School District and the percentage of our teachers that have gotten vaccinated in comparison to neighboring school districts, it's not comparable. So without identifying any specific school districts, there are school districts in more affluent neighborhoods that have 100%, nearly 100% of their teaching staff that have been vaccinated. And for us, I believe it's only 60% that have gotten their first vaccine. And so I think it's just that, going back to that, how do we think about what are the communities that are most affected, as everyone has said, and starting from there and then rolling out, versus these other plans that may feel to some group of people as equitable, but it doesn't really roll out that way. I don't think there is ill intent. I just think that, once again, we need to have more people at the table to have these discussions, have thoughtful discussions.
So are the teachers responsible for getting their own vaccinations, or is there a system set up that is assisting them?
Well, there are systems that are assisting them, but we are not able to force teachers to be vaccinated. It has to be by choice, it's by volunteering. But the way that it was rolled out, there were priority groups, and those priority groups are the ones that impacted when and how many were available to each school district. And because of the way that East Palo Alto had been in the purple tier for over a year, we had less teachers that were on site working with students in person, which put us at the very bottom of the list as far as prioritization when it came to vaccination, which has also prevented and delayed us from being able to reopen sooner rather than later.
So where is the school district now?
Right now, we are in discussions about getting a hybrid model up and going. As we know, our numbers are changing even in our community, right? There's improvements in the numbers of positive COVID cases. So we have a board meeting next week, 2 board meetings back to back, to talk about how do we get students back on campus? How do we get in-person instruction to happen? Because we know that for the majority of our students, distance learning is not working.
So, the county manager said this week that the supply is somewhat flat in terms of the vaccine. So with the supply being flat, and I heard today that what's being given is 1/3 less than what the demand is. So what's being done to right this particular situation? It's hard to give more vaccinations if you don't have supplies of the vaccine.
Yeah, so this Louisa. So one thing, yes, part of why that's happening is because the vaccines are being diverted to other areas of the state, larger metropolitan areas where there are populations in East Palo Alto, people who have suffered a lot, like LA, Fresno, Bakersfield, San Diego, where they can reach many, many people at the same time, but it's happening at the loss of vaccines being available here. So the redistribution of vaccines has resulted in fewer vaccines to the counties. And in Santa Clara County, while we have more than 5,000 adult patients, we're only being given less than 100 vaccines a week for our own patients. So when we here in East Palo Alto, San Mateo County, on the other hand, is giving us as many as we can get. And so we are specifically working with the city of East Palo Alto to do the outreach to the residents in the city, because we don't have enough staff to do the outreach. So they have a number where people can text their information if they are in an eligible group. We're getting them into community-wide vaccines at our clinic, as well as vaccinating our patients. And we have 11,000 residents in East Palo Alto who are patients of the clinic. Now, some of those are children, but nonetheless, we are both prioritizing our patients and community residents and making sure they get first in line at our clinic. And we've, as of this Saturday, we will have given over 7,000 vaccines since the 9th of January.
Sure. So what more can be done on a state level? It seems there is the assumption that there are enough vaccines coming into the state of California. So how is California doing in comparison with other states when it comes to getting vaccines?
Well, I'd say there's not enough coming into California. That's what the governor would say, right? He said he just say there's not enough, and he feels like that'll change in 2 or 3 weeks, but he feels there's not enough. That's why we do have the problem that we have. But I think the reality is we still do have there are vaccines coming in. It's not as many as we would like, but there are vaccines coming in, and we can choose where those go. And that's why early on I made a big push for vaccinating teachers. As Anna said, it's just and Louise said, I think, to me, that was just, I have kids in waiting to go to high school at MA. So, but it's like, we got to get teachers vaccinated. And so, and then the county did prioritize teachers and has done a pretty good job. Although, as Anna said, there's still, even in Ravenswood, some that still have not gotten vaccinated, but most have gotten at least their first vaccination. And then what the county's doing next week is they're just saying, great, we're just going to shut down that mass vaccination site, and we're going to give all the doses to East Palo Alto and East Menlo Park and North Fair Oaks and Daly City. And that's frankly the right thing to do. That's just the right thing to do for all the reasons that we've talked about. So, I think as Louisa said, there's a tendency to go, let's give a little bit here, a little bit here, a little bit here, and I think now the county's saying, no, we're not going to do it. We're going to kind of go all in here. And that's really just, what needs to happen. And, it's could happen. Well, anyway, it's happening now next week. So it's better late than never.
Sure.
Just if it's all right, just to add on to what Josh said, which is absolutely right. I mean, we're not getting enough vaccines, and the vaccines that we're going to be getting are going to be flat for the next 3 weeks from some projections that I saw today or yesterday. And then part of that's also the J&J vaccine and production problems that they had. We were expecting this huge glut of one-shot vaccines that were easier to store, easier to distribute, that haven't materialized. But a bigger challenge, and following up on the inequities from earlier, is that a lot of the vaccine that we're getting now is going to second doses, to people who already got their first dose, which we need to do, but that just means that it's going to people who, don't live in the hardest hit communities. And so I think that's compounding the problem because of the earlier decisions around, right? And so more of the vaccine that we are getting are going to not to East Palo Alto, not to Bellhaven, not to North Fair Oaks, but to people who managed to work the system 3 weeks, 4 weeks ago, and get that first shot. So that's another challenge that's kind of compounding the problem.
Some had suggested that you start giving those who don't have the vaccine their first shot, and then give others the second shot. That there is not as much urgency in terms of time for that second shot. Was that something that was worthy of consideration?
I'll defer to the medical expert on the call.
My cat's biting me, sorry. Yeah, so no, actually that isn't okay, because you do need that second vaccine within a certain period of time to keep that immunological process going in the body to produce the antibodies. So you're getting the greatest effect. And the studies that they did on you know, in Moderna, I know on 40,000 people, is that you don't want to go, it starts waning, your immune response starts waning after 2 weeks post the 4-week period that you're due for the second dose. So you start losing your the efficacy of the vaccine after 2 weeks past the period when you should get the second dose. So it is really important to get that second dose. You
Well,
only get 50% immunity with the first dose.
sure, it certainly seems then that those issues in terms of equity are kind of compounded because of the way things were set up in the first place. Now, I heard that maybe there's 28% within the county of San Mateo that who have received their first dose in terms of herd immunity, and it would take at least 70%. And we're in an orange tier now where things are opening up. Do you think that's where we should be? Do you think maybe we're still opening up too quickly? Antonio.
Yeah, I would be happy to jump in. I think as an EPA resident and leader, it is very difficult to celebrate an orange tier at this moment when you have 32.2% of the county that is vaccinated, and you have about 17.6%, and we have almost only a little bit more than half. And so what is the tier of East Palo Alto? And so when you think about from a local perspective, putting in danger the community, I think for me, if we're gonna go orange, let's not forget the black and brown, right? That's what I'm saying right now. We're talking about moving ahead, but who are we leaving behind? And I think if I understand the economic imperative of getting things back to normal, I understand the social and mental deterioration that folks have. This has been a year. We've talked about, I've seen articles around, I think, grief around COVID. Mental health has declined for a lot of people. People are getting therapy, weight issues of body. I mean, just a whole plethora of physiological harm. And at the same time, that can't be at the expense of the community that I serve. And I think so if we're in this 3 weeks, what I think we should really consider is how are we going to get communities like East Palo Alto, not just Palo Alto, North Fair Oaks, communities that are hardest hit, which is, by the way, that one of the things that the county announced today, that we're going to work on the hardest hit communities. And so that's not my standards, the standards of the county. And so I think moving 3 weeks ahead, all stops, as Canepa said, Supervisor Canepa, we should be laser focused on those zip codes most hard hit. We should have clinics, and we should have not have folks go to SFO, but to their own backyard, understanding that they can't take a day off per se. They have kids, families. And so I think we're at a moment where the county is positioned to really take a stand and really, and by the way, I should say, I'd be remiss if I didn't say the collaborations they've already had with the Ravenswood Clinic has been doing a wonderful job. We had a YMCA clinic a couple of weeks ago. The county is advocating for us. I want to be very clear. I do think though that the numbers aren't there. And if we want to move to a new paradigm of what the vaccine of COVID, if you will, you have to see, you have to verify if all communities are at that stage. And at this moment, they're not. You just if you look at just a sober look at the numbers, they're just not there. And so how are they going to get there? I would love to see an aggressive campaign answering that question in particular.
Well, supposedly the county has an equity metric system, at least San Mateo County does, where it's not supposed to move ahead until the most vulnerable communities have reached a certain point. And the county's moving ahead. It's one of the first right now to hit the orange. So Pastor Bain, should things be opening up?
That is a very challenging question because on one hand, you're dealing with the disproportionality of deaths that are plaguing the Black and Brown community. And on the other hand, you're dealing with high unemployment and businesses closing And these are also people of Black and Brown. And so it's a very challenging question. And I think that we should be opening up, but we should be opening up very cautiously on the types of businesses that we're opening up, where the protective measurements are implemented and utilized. And if people don't comply because they have this lackadaisical approach, maybe they've already gotten their vaccine, that there should be consideration on penalizations of those businesses that will not comply. The other part of this equation, though, is not just Black and Brown people, but also those that are homeless, which, they don't have access to everything that people who are living in their apartments, in their houses, and even in their RVs. And so, I know it was discussed about saving some of the Johnson & Johnson vaccines for the homeless, because then they don't have to come back and take 2 shots, which is already hard enough to reach a homeless, AKA unhoused person. So we must not forget about the unhoused population because they're the ones that are dying just as fast as well.
Sure. Other comments on that? Assemblyman Berman, would you recommend that we begin to open things up now?
Doing it slowly, doing it cautiously. I am not a medical expert, and so I try not to play one on TV, and I try to depend on the expertise of others, but also want to verify and make sure that they're really, that the numbers that they're putting out are accurate, and that they're taking the right considerations right metrics into consideration. So I think that's important. One quick thing that I did want to add that Senator Becker and I both did this week is we voted to expand paid leave for workers, including to get their vaccination. And so if a worker needs to take a day off to get their vaccination, if somebody has a really negative reaction to either dose, but especially that second dose, and they need to take some time off, that they'll now be able to do so in California, which was really important, I know, for Senator Becker and myself.
Terrific. Yes, Senator Becker.
Yeah, I mean, I'd say the one thing that I do feel should be opening up, to echo what Trustee Palo said, is the schools. And I think she spoke eloquently about why distance learning is not working for many in the community, and both at the elementary and middle school level and also in the high school level, really people in East Palo just haven't had any option. And there may still be people who don't feel comfortable at this point, which is fine, certainly at this point. But for the people that do want to go back, giving them an opportunity to go back, all the data shows that schools are safe. And of course, we do want teachers vaccinated, and we should get those last 40% if they want it. Again, maybe we can't force them to take it. But I think, to me, getting schools back, more than bars or restaurants, and getting schools back is a priority.
Now, the schools might be safe, but it said that the students themselves could be asymptomatic, and they would be bringing the virus home to their families. And even if the elders in the family have the vaccinations, those in the middle would not be protected. So
that's why I think that San Mateo County Office of Education, you have to submit a plan to the San Mateo County Office of Education that has to address all, health and safety related requirements that would either prevent or significantly decrease the spread of COVID. So whether that is 6 feet, social distancing between students, whether that is wearing masks on site, whether it's creating clear, entry points and exit points so that people or students are not, I guess, too close. So I think there's a lot of measures in place that schools can place, based on the guidance that we've received from San Mateo County Office of Education, to make this happen and to either slow down and prevent the spread of.
So do
even
you
symptoms.
really think it's practical to expect young people to stay 6 feet apart?
Well, it's not entirely practical, but then that's why they want to put in measures like plexiglass between students, right? You put them around the desk, and whether or not a student is not wanting to stay in place, there's kind of protections in place, right? So are students going to need reminders and guidance and supervision? Absolutely. But I think that we are so focused on the barriers and obstacles that we're not looking at the opportunities and the supports there are to making this into a reality. Our students are suffering as far as their education is concerned. There is learning loss, although I know that's not a term that people want to use right now, but that's the reality. And I feel like there's enough guidance to have us do this safely, and we need to kind of follow that.
You said something intriguing before you make a comment, Councilmember Lopez. You talked about people not wanting to hear about the learning loss. Why should that be a problem? It seems it's very obvious that there would be learning loss, especially for those in vulnerable communities who are already disadvantaged by conditions, lack of money, going to school districts, etc. Even before COVID.
I think it's the term learning loss. I think they're trying to use learning acceleration instead of learning loss, right? What do we do to accelerate learning rather than focus on the learning loss that's taken place? And I think I think the idea is to look at it from like half full versus half empty. I'm not sure. But the reality is that this past year is going to create loss in our students' like educational journey. And we have to figure out how to remedy this as soon as possible. And that is my belief as a community member, as a board member of the Ravenswood City School District, that our students need to be back in the classroom safely as soon as possible.
Sure, Councilmember Lopez.
Yeah, I just wanted to piggyback off of what Trustee Pulido said, and I think just to answer the question as well, I think part of the reluctance, one of the deficiency model of looking at communities and saying what is the negative, I think pedagogically, right, Pulido, we try to move from that. But second, there's also, I've met quite a few teachers who feel that that term undermines the work that they've been trying to do for the past 12 months, that they have been really trying to confront this pandemic, have spent hours to create lesson plans that are innovative. And so if we only focus on the learning loss, I think part of the issue is that that work is being, swept under the rug or overlooked. But I agree, I think we can't ignore it as a problem. I just think that's kind of the teacher's perspective. I could very well imagine an educator saying, wait a minute, I've been, busting my butt off to try to keep these kids engaged, when they have the black boxes and so forth. I wanted to just add in terms of a moment ago, equity. I would love to see the county have an aggressive educational campaign that is catered to hard-hit communities, because each community is going to have a different experience of why I went out to take COVID. African Americans, we can go back way back to Tuskegee, and that memory of, do I trust that government-led distribution in part? The undocumented community, they're going to have language barriers. Pacific Islander community, historical access to healthcare, health disparities. And so when I see the literature that is being put out on a regional level, I think we miss that nuance. And I think if you're really committed to seeing Black, brown, homeless, low-income folks in the front lines, you have to say it in a language they understand. I don't just mean Tongan, Spanish. I mean, what are their anxieties? What are the fears that they have? Why are they not here right now? As ridiculous, quote unquote, as it may seem, one thing I've learned in my short time in office is you have to meet people where they're at. And I think that is something that we need to have at the best in the next several weeks. You have an opportunity to do that. And this pause, if I can find a silver lining, gives us that opportunity to reflect, to strategize, to coordinate with the players, and really have a plan that confronts the equity issue head on.
Just to add on to that, if I may, Henrietta, couldn't agree more with Councilmember Lopez. For the last 3 years, I'd chaired the Assembly Select Committee on the Census, where we focused on trusted messengers and we focused on totally micro-targeted messages to certain communities across the state. And 6 months ago, a couple of us, myself, Senator Pan, Dr. Pan, who had led the effort on the Senate side, said we need to be doing the exact same thing around vaccines. It's the same playbook, different plays, but the same playbook, and it's so important if we're going to increase, willingness and acceptance of the vaccine. So completely agree. I had a bunch of thoughts on Trustee Polito's, spot on comments, but I don't want to hog the conversation.
No, go right ahead.
One thing that the state did announce today, and I'd love to follow up with Trustee Polito and the district and make sure that Ravenswood has access to this, is Governor Newsom and State Superintendent Thurmond announced the deployment of up to 3 million free rapid COVID-19 antigen tests to help high-need schools safely reopen. And in the press release that I was just quickly scanning, they say that they follow census tract data from the Healthy Places Index, not zip code data. So I want to make sure that, Senator Becker and I'm sure we'll follow up and make sure that Ravenswood and the school district and the poor communities in our districts get access to those 3 million tests, because the cost is a huge impediment for the school districts. I mean, these tests are expensive. But to your point, Henrietta, of making sure that we can test the students once a week, it's not going to be every day, but once a week or once every 2 weeks, can give everybody a little more comfort that it is safe. And Senator Becker and I had the opportunity to be in a classroom a couple of weeks ago. You'll be surprised. These kids know how to follow orders. They stay, 6 feet apart. They had the plexiglass. I was impressed.
Is that when someone is looking at them?
Well, a lot of us were looking at them, so it's a fair point. That's a fair point.
I will say that we were part of the pilot program that the state had first, or I think the county actually had first issued. So we do have the testing currently, but we want to extend it through the semester so that we can also create that assurance, that additional assurance to our families and to our teachers that we're taking all the measures needed so there's a safe and healthy environment.
Sure. Now, Louisa, given the multicultural community that the Ravenswood Family Health Center covers, let's follow up on Councilmember Lopez's idea in terms of reaching people where they're at. Is there anything more that can be done from your perspective that's not being done to reach the communities that you serve?
Well, there's always more. And so what we're, and with rolling out vaccines, literally every day, there's something new that we're working on and something we debrief after every event. We're trying to make sure that we have like every single language. Now we have, I think, 10 different languages translated for every consent form and that we give to patients. And so not just the highest number of languages that we always see. And the other thing is, we're thinking about communities to reach out to. So nonprofits who've approached us, there's a group in West Acosta, for example, gives out food to families at home, and they distribute on Wednesdays and Saturdays. And we're going to vaccinate this weekend their staff because they weren't eligible until the food workers were eligible. And yet they're going to homes of people that are in isolation and quarantine. So really important. And then, what some other groups, like I actually was going to email Gina Sidaria today. I was thinking, I wonder if the teachers all got vaccinated, because we have these clinics coming up and we should reach out to the Ravenswood School District, not just the teachers, but also the grounds people, the janitors. I mean, everybody that works there needs to be vaccinated, and it's allowed. It's not just the ones in the classroom, because it protects everyone. So we're thinking also ourselves as a clinic, who can we reach out to make sure that all these little special populations that serve our community, that are in our community, are reached, and we will continue to do so.
Sure, terrific. Yes, Senator Becker.
Yeah, I just want to add on that because I saw it last week, because I'm losing track of time, but last Tuesday at the Euclid Clinic, where a lot of the Tongan community was not coming, and Anamanatangi, Pacific Islander Voices, the Mama D came, and the family came, and some of the pastors from some of the Tongan churches came, and people took videos of that they could then bring back into the community to show them show other folks that this is safe and that the elders are coming for the vaccine. And my friend Shauna worked very hard on that. And so that was great to see. It's an example, I think, of what Louisa was talking about.
So you think, all of you, that things are running in the right direction and some of these issues in terms of equity are being addressed?
Well, I wouldn't say things are all running in the right direction, because we're still dealing with the issue of disinformation and misinformation that is running rapid out there, particularly in communities of color. And so that still needs to be clarified and uplifted with trusted sources of the community. We have to take some of this and make sure that we are getting the right messaging out from whatever, and I would say pulpit, obviously from the religious standpoint, but from wherever platform that we have. And we have to consistently say and communicate this message again and again and again. Because people, they drop their guard when oh, well, it's getting better in some places. Well, we can also resurface too. So we have to be cognizant of that and mindful as we push this message out.
Sure. We have a question in the chat, and I think this person, Jui Sawarte, could be unmuted to allow her to ask her question. It's about the data.
Hello, thank you, Henrietta. Hello, my name is Zoe Sarwate, and I had a question about the use of data in equitable distribution of vaccine and COVID-19 education for communities that need those resources. And we know that seeing that accurate public data has allowed local groups to address the needs of those that are most impacted. And also we've seen that issues and errors with that data can also lead to a lack of public facing knowledge of areas that might need the most help. For example, most recently reported about with the North Fair Oaks area. So what is the importance of that public facing data that both the government, distributors, and the public can use in order to have the most benefit for our community? Thank you.
I'll quickly jump in. I mean, it's so important for the data to be accurate because as we struggle with issues of trust around vaccines, around misinformation and disinformation, we need the public and we need advocates and communities to run their own numbers, get comfortable with what's happening, and then go out and advocate in their communities. And so it was I don't know all the details. I read the same article that you're referring to, and it was very frustrating to see that the data, I understand what they were saying about, okay, the data on the back end is accurate, and so the decisions we were making weren't impacted. But your point is, I think, very spot on, that the public needs and deserves access to accurate data as well.
Any comments, Senator Becker?
Yeah, I'll add on that, absolutely. And we still don't have actually the fatalities by region. That's one piece that we actually still don't have. But I absolutely agree. We saw that in North Fair Oaks because people will probably say, oh, well, yeah, there's not a lot of cases there. It turns out, yeah, there were a lot of cases there, and that cases are lives, as we know. And so we got to get the data. We got to get the data right.
So I have a question. Right now, there are concerns about a vaccine, and I may not be pronouncing it correctly, AstraZeneca, Louisa, and it might be implicated in terms of blood clots. And although there are health experts saying that there's no relationship. And I heard today that our country is trying to make sure that Mexico and Canada have adequate vaccines. And they're trying to get that vaccine to these two countries. Does that make any sense to you? If Europe is beginning to put a halt to the distribution of that this country is going to be active in getting the vaccine to Mexico and Canada?
I think they really need to understand, why this is happening, because it isn't just a case here and there. And it isn't massive numbers of people either, but it's still very worrisome. So why did it happen to those people? What were their underlying conditions? And how do we avoid that? Because, one of the things we ask all kinds of health information when we do give vaccines to find out if people might have something that would make them more apt to have a reaction or a bad reaction to the vaccine. And sometimes you don't know. And so, I mean, it could be completely out of the blue, but if we can study those that did, and there are enough people that they can do those studies on, that's why they're pausing it, to try to understand why that has come up in the incidents of these people. I think they should wait. I mean, because if a person has access to that information, I would feel personally very uncomfortable. Certainly also at my age, even though I have no health disparities, why would I take a vaccine, even as a public health nurse, which I am, that has a high risk when there's alternatives that don't have that kind of risk? So yeah, that is a concern. And I think that people, again, that's one of those things where they should pause and here also in promoting something. My sister actually is the National Health Service nurse in Wales, and she's due for her second AstraZeneca, so I'm keeping my fingers crossed.
Oh, interesting. Now yes, go on.
Just a quick note on kind of the vaccines and vaccine efficacy. The governor has set up, and I was quickly I don't remember the name of the committee, but a committee of experts. It's now a Western states kind of vaccine research group of experts to look at all the vaccines. Once the FDA approves any for use, they then, these medical experts, including one, Dr. Maldonado from Stanford, who was kind enough to join me for a town hall in mid-December, look at the data and make a determination for, I believe it's California, Oregon, Washington, and maybe also like British Columbia or something, to triple check everything. And so we are trying to make sure, at least in California, that any vaccine that we provide to our constituents is safe, and that data has been scrubbed and checked to confirm that.
Sure. Now that raises a question, and I think it's commendable that our country is trying to reduce that gap in terms of the distribution of vaccines to other countries. But do you think the emphasis, the priority should first be on getting adequate amounts of vaccines to states like California?
I think that should. I mean, I'm very biased as a state assembly member, but I absolutely think that that should be priority number one. I know there's been a lot of research done and articles written that I have not read that do talk about how it is important to make sure that worldwide that countries don't get left behind. And so all I'll say is, I know there's a school of thought. I don't know what the school is, and I don't know enough about it to speak to it. But people who my job is to look at things pretty micro. People who look at things macro, do think that there's some merit there. But when East Palo Alto is still half of the vaccine, uptake of the county as a whole, getting vaccine to East Palo Alto is going to be my priority.
Sure. There is an issue that came up in some of the meetings that I've been a part of. And it was mentioned about Stanford treating members of the East Palo Alto community. And one issue that I heard community residents run into while the vaccine is free, that they still have to produce their credit card. And if they can't produce their credit card, then they can't receive the vaccine. In other words, they have to get into Stanford's health system first. Do any of you know anything about that, and what can be done about it, since we're talking about equitable distribution.
Yeah, I heard about that as well. So I reached out to David Entwistle, the CEO of Stanford Health, and I asked him about that. Sorry, I'm having camera issues here. And you know, he said that they were not charging people, but that they were using the credit card as one form of identification around, you know, sort of second doses. But he acknowledged, he said he realized that that was still seen as a barrier because it was intimidating to folks. They didn't know if they were going to be charged. And so that he said they've now stopped doing that for the clinic they're working on East San Jose, and that they would not do that in East Palo Alto either. So that's what I got from him, and I also have my team following up with the Stanford Health people just to make sure, because I also heard that, you know, again, this is supposed to be free. I heard that it was, some people said that it was free if you had insurance, but if you did not have insurance, that there was an administrative fee that was still quite high. It was over $100. So if that's the case, that shouldn't be the case. So we're still looking into it, but I did text with the CEO, you know, yesterday of the hospital, and he said they would not be using credit cards anymore.
Sure, because I'm thinking for people who may not have them.
Yeah.
Who might be cash only or
Right.
yes.
Again, it's just one of those barrier, exact kind of thing we're talking about earlier. It's just a barrier that just doesn't need to be there and shouldn't be there.
So what other issues, since we're all together talking now, have we not discussed that you think we should discuss? And those issues that might concern you?
So when I was talking to the Blue Shield rep today, and like, you know, she, a very nice person, also has worked in public health, and, you know, was very clear. I didn't want to shoot the messenger. She's not the person who makes the decisions. But I had many questions about the way we were told as community health centers that after a certain period of time, the only way we're going to get vaccines in the state of California is if we register people in My Turn, which is a proprietary application, and then only then we will get the vaccines for people who have been pre-registered. And one of the barrier-free ways that we are distributing vaccines is we give people an armband, and they come and we take the information that's only the information that's absolutely required for the immunization registry, for CDC, mostly health information. And, you know, we want to know where they live and everything in case they have reactions. There's all kinds of important information, but we don't take health plan information. We don't take their social security number. We don't ask things that would make people feel uncomfortable. And we also don't make appointments. So we give people armbands and that have times on them, but we also say if you arrive early or you arrive late, we'll still see you. So it's really, we're trying to reduce all those barriers. But with My Turn, if we have to register people in advance in order to get the vaccines next week, we're not only is it a second effort, we're going to have staff that do that, reach out to people, sign them up, then they have to come back next week to get the vaccine. And you know, already we try to do evenings and weekends because that's when people don't work or can potentially come in. So, you know, these are, to me, that's a barrier. But we were told that in the future, it's possible that the county will not be able to give another health care institution any vaccines. They will only be able to give them to people who are not connected to a healthcare institution. And the county could give the vaccines, but would not be able to give them to us in the future. So that was the intent, I think, when My Turn and Blue Shield took over, that everybody would have to use that system. And I know there's some breakdown that's happening, but what I still don't know is, will the county continue to be able to get vaccines for us in the future? And there's also other kinds of things where, you know, they look at whatever you did last week and that's how they decide what you're going to do next week. So there's more capacity for giving vaccines than there is supply. And as the supply keeps shrinking by virtue of this distribution plan, it's going to look like we aren't giving as many, and therefore we don't deserve to get some next week. So there's a lot of catch-22s.
Yes, and I heard today in terms of My Turn that the county will be getting into more than it is using the My Turn system. So those issues that you brought up are going to be inherent in the system itself. And I heard today from county officials that they find out 1 week before, let's say on a Tuesday, exactly how much vaccine that they're going to be administered. That they're supposed to find out on a Tuesday, and sometimes they don't find out on a Thursday. So I'm thinking how difficult it must be to schedule events and promote events if you only find out week to week how much vaccine you're going to get.
And unlike testing, it takes about 120 to 160 staff to give that 1,000 vaccines. Now we are able to do 100 vaccines an hour if we have them, but I need team leaders that are our staff that know the drill. And then we have lots of volunteers, which is wonderful. We have a list of over 360 volunteers, and some of them are licensed and some of them are just there to wipe down chairs and keep them clean and wipe down pens and clipboards, and other people help the line and other people translate. So it does take a small village to do that many vaccines. So parking lot attendants, all those kinds of things, people putting people in wheelchairs and moving them around. So it's in some ways, it's also like a village celebration. Everyone's so pleased and happy. We had Senator Becker and a group of outreach workers cheering us on last weekend and cheering the people who came to get vaccinated. So it's a very uplifting process, but it is very complicated.
Well, we have our state representatives here. Yes, Senator Becker.
Well, I was going to add on to what I think it harks back to something that Council Member Lopez said earlier, which is, and Louisa sort of referenced it, which is, it's something that Scott Morrow, our health officer in San Mateo, told me a couple of weeks ago, and he just said, the state keeps talking a good game about equity, but every time it's made a decision, it doesn't prioritize equity. And I asked him what he meant, and that was one of the examples was this emphasis on efficiency. Like if the only metric is shots in arm, how fast you're getting shots in arms, and if you're not getting them fast, we're taking them away from you, then that's not prioritizing equity. Because as we've discussed, it takes longer to reach these communities. You may have to meet with someone once or twice. You may have to go door to door. Marie McKenzie and Michelle Dower and others, going literally door to door to get people to sign up. And that can take longer, and that's okay. That's what we need to be doing. And so if, again, and that's where, this emphasis on my turn, again, is misguided. My sense is it's working. I've seen the bracelets, we don't need, if we just have everyone get my turn, it's just going to make it that much harder. So, that's for someone Berman and I to take back to the state, in which we tried, which we're now, trying to do, and like say, hey guys, you have to change this if you're really serious about equity.
Well, we would ordinarily say, write your state senator and your state assembly member. So what can people do?
And people are. We see the emails and we hear about the phone calls. But hearing this from Louisa is super helpful. I mean, just yesterday, I went on a walk with some colleagues, and we were all complaining about different components of my turn. So it's helpful to hear this as well. And we're building the plane as we're flying, and so we need to be able to identify when things don't work well, and change strategy and change tack and see what's happening on the ground and kind of adopt to that. And so that issue that Louisa just brought up is very informative for Senator Becker and myself to be able to go back. As you all have seen, just because we advocate doesn't mean we get what we want, and that's just kind of the reality of we're not the governor, but we'll keep on doing our best to advocate for our communities and just at least raise up these real problems and concerns and issues that exist in our districts.
So what can people do in assisting you in advocating? Should they be also emailing the governor? And so what actions can people take?
I'll defer to Councilmember Lopez, and then I'll add on. I'm sure he'll cover it all. But
I'll just say pressure. I mean, I'm kind of feeling facetious in the moment, but we need to think of this like running for office. what is the goal? Getting shots in the arms of people, right? Getting support from people, but also critique the opponent, or not an opponent, but be critical, right? We have a governor who's getting recalled, right? Isn't this not, or preparing to be recalled? Could we not spin this as, this is a moment for Governor Newsom to affirm his commitment to low income, African American, Latino, other communities, Pacific Islander, homelessness? If we saw that on the local level, his concern, his passion, you know, I think for me, that would really erode the naysayers and really undermine that backlash he's been getting, because one of the main criticisms has been his response to the pandemic. And so I think being strategic about how we're not just using the moral argument, but the political argument, because that is the end of the day, that is how we're going to be able to get the vaccine. It's not using economic arguments about, you know, stimulus. It's not just about the moral argument, but politically, how do we make sure it's at the table? And speaking that lingo, having people who are adamant and courageous enough to do that, as we have folks in this table, to be candid, but also collaborative. And so I think that kind of art of diplomacy, and you having the support of the community to vocalize it and saying, we are laser focused on what the governor is doing, what the leadership in the state is doing. And if you want us to truly reelect you, then you have to take a stand right now, because there are lives at stake. That is not a threat. It is just what you were called to
Sure, and
do.
who's going to take the lead, Council Member Lopez?
Well, I don't think it's the lead. I think it's understanding who are Trustee Pulido's people. Who does she have the ear of that I do not? And respect Assemblyman Berman, to Luisa, and understanding that this is not a sort of one person championing it, but this is really which resources do we have in this table? Who does Pastor Baines know that I do not? And putting aside, which I think happens in the city, any kind of history we may have as colleagues, and saying we have to really focus in on what's happening right now. Bipartisan, go ahead, sorry.
No, I was going to say, you drafted a letter that you sent out in an email today. So would you be willing to draft something that we'd all put our names on, our signatures to? How would this get started?
Well, I don't want to monopolize Assemblyman Berman. I'd love to, you know, or other folks. I don't want to keep sort of just, you know, me taking the mantle. I'd love to have other discussions, but again, the spirit of collaboration, sharing resources, putting pressure in pockets that we have. I think it's sort of, you have to play strategy. I think that's what it is too.
Okay, reactions, comments, ideas.
Well, yeah, I mean, I think we have to take the mindset. We know that this is a huge problem for everybody in America, everybody around the world, but we have to be more solution driven than problem consumed. If we're not addressing this problem synergistically, then we're doing ourselves an injustice, because none of us is as strong as all of us on this call. And so we're better together than we are apart when we talk about moving the needle significantly to the most marginalized in our community, in our county. We can just do it better together, is the bottom line. And that means titles, you know, relationships, influences, all that has to be a part of the process.
Well, in the few minutes that we have left, what can we do? What would you advocate, Senator Becker, others do to move the issue of equity forward?
Yeah, well, I think Councilman Lopez said, well, you got to speak up, and we can't be afraid of ruffling feathers. You know, that's what we did at this press conference, you know, a few weeks ago. And that's why, you know, we're calling our own governor, you know, on certain things when we don't think that, you know, he's doing a lot of great things, and, you know, but like we think something's wrong, we got to call it out. But I think you're right, that pressure works. And I've seen, you know, parents want to go back to school. I've now seen parents organize, and they're writing the health officers, and they're right. You know, it's like, I think everyone's sort of seeing it that, you know, through this, it's actually encouraged a lot of grassroots, you know, activism. There's Cecilia Taylor in Bellhaven, you know, organized Bellhaven Action, and, you know, and helping, you know, push for a clinic there. So it's just like, you know, there's just a lot going on. Luisa said it's all super complicated, but you know, but getting, you know, you know, it's a thing we've just seen. There's no, I don't know what the right word is, but there's just nothing better than just organizing, really.
Sure. And it's my understanding that some representatives of communities of color have already come out to support the governor in the recall effort that he's currently facing. So adding additional pressure along these lines might simply be heard.
To Louisa's point at the very beginning about how we don't have a statewide health minister, yeah, what that means is that politics influences policy, and yeah, I'm not going to go too far down that path today, but it's a factor. This all impacts decisions that get made, and so applying pressure, advocating, we can all, there are different strategies that we can all take just at this table, and then when you expand that, but not giving up and making sure that the cause is righteous, and so that's why Senator Becker and I, Governor Newsom's got an incredibly difficult job, and I don't envy him, but our job is to advocate for our districts and our communities in our districts that are in the greatest need. That's why we ran for office in the first place. So, that's why you see us going out a little further on this issue than we might otherwise on other issues.
So when can we see some change? I think that's what people will want to know. They could say, well, we've heard the talk and it sounds good. We know you're for us. So when we've talked about the action.
Yeah, I think it started last week with the 400 people on Euclid, and then the Bellhaven over the weekend. But I think we're really going to see it next week. I mean, the announcement's been made, the word's out there, and if it doesn't happen next week, then we got to really. But I mean, I think it's going to happen, but we got to really keep the focus, and that's what the promise is, and we got to make sure that happens. So it should be very soon. I've heard, I think as early as the 20th. Louisa, I don't know if what you've heard, but I think I've heard as early as the 20th of some, really starting the bigger focus in the community.
Louisa,
we're doing vaccines on Saturday. We have second doses, about 378 and 220 first doses. And then so that's a community-wide event. I know that Menlo Park is working with the county and doing an event at Nana Harris on this Saturday. We're doing Thursday evenings. So we're working with Marie McKenzie and Michelle. There's a waiting list in East Palo Alto. I mean, that's the other thing. And people who want the vaccine, we want to make sure they get it right away. So we're working down the waiting list. So we have about 300 vaccines we're doing on Thursday. And then on the 27th, we're meeting also with Facebook because they have a larger location, and they're going to help out also. So we're not sure how many, because it really depends on how much we get from the county. And right now, Moderna, they're running out of Moderna, and so we're going to have to switch to Pfizer. So so we would like to do 1,000 on the 27th of March, but it just depends on how much is available. And now that the county is also doing other events with other, we're not the only ones doing events during the week. Some other agencies and groups are working with the county to reach people. So that's all good. I don't know about the other dates, but those are the ones I'm aware of.
And you mentioned a waiting list, which means if someone doesn't show up, the vaccine isn't lost. It's not wasted. There's always somebody who's standing in line.
Exactly. Yeah. Yeah. We have so far out of, tomorrow will be over 7,000 that we've given. We've only wasted one vaccine since the 9th of January.
Terrific. Now, yes, Assemblyman Berman.
Oh, no, sorry. I was just giving a thumbs up to only wasting one vaccine dose. That's fantastic.
Okay. I did say in the few minutes that we have left, and we have very few minutes left. So what is there that needs to be said now emphasized, shared that hasn't been shared, a concern, a positive mention, whatever, in our final minutes?
Vaccines are safe, and people need to get vaccinated because all of us will be able to get back to some normalcy once the majority of the community are vaccinated. We're also going to reduce the possibility of variants because every time someone gets a COVID disease, you're running the risk of a mutation. So think of it that way. Let's get vaccinated while we have vaccines for the wild version of COVID-19, because we don't have vaccines for the variants that may not be responsive. And so that is, that will be a continuation. So having as many people, everybody who could possibly get vaccinated, it's the way we're going to get back to some normalcy.
Sure, and having vaccines for all those people who might want them standing in line. I understand that getting vaccinated is the way people can get together again, to hug their grandparents again, to continue life as it was before. Will life be as it was before? What do you think about that?
I haven't been sick for a year, so I might keep wearing some masks in certain circumstances. That was nice, and I'm definitely gonna keep my Purell on me at all times, or whatever generic version I happen to have.
I guess that might be a selling point for those who don't want to wear masks. If you don't want to get the flu and you don't want to get a cold, put on the mask. Any other comments, ideas? Anything you'd like to leave the viewer with? Yes, Councilmember Lopez.
I would just say, on a federal level, I think what President Biden did in giving us that July 4th image of we can have barbecue. Here in East Palo Alto, we know what the metrics of despair are. I mean, we can recite them ad nauseum. We know how tough it is for ourselves. What we need is hope and positivity. Maybe a better word intended. We need optimism. And so I think having a county leader to say, hey, by the Juneteenth, we're going to be together. By Cinco de Mayo, we'll be able to be together. But it's going to take every one of us to socially distance as much as you can, to sign up, be on the queue for the vaccine, to talk with your family members who are hesitant, to debunk that. Really, it's just all hands on deck. And I think it's easier with the carrot than the stick. And the carrot here is that we're turning a corner, but we have to still maintain ourselves and to be have that fortitude to keep on going. And I know Pastor Baines, you're a pastor, so you know that well, to give folks that faith. And I think that's what we need. We're so close, but giving us that image of, again, the Juneteenth, the Cinco de Mayo, the other celebrations. The summer's on the corner, but we're not out the woods yet. And I think that's what we can do meanwhile, civic as leaders.
A last chance.
I would just remind whoever's viewing that, we serve the public as elected officials. The majority of us that are on here hold us accountable to our commitments, to our promises, to what we're saying we're going to do to support our community. Don't let us off the hook by having these great conversations and leaving it there. Remember to circle back and say, hey, you said you would do this, you committed to doing this, and we want to see it happen. So let's make it happen. So just reminding everybody here, we're here to serve the community. We're here as servants of the public. So don't be shy to apply that pressure and hold us accountable.
Well, having said that, would each of you like to give a promise to viewers now and we can hold you accountable?
Since I started off the promises, I'll start off. I promise to work very hard to get our students back in the classroom as soon as possible. I want our students to return to in-person instruction in a safe manner. And I promise to my community that I will continue to be advocate on the board level to make that a reality so that we can alleviate the burden of parents and we can also start doing the learning acceleration that we're all talking about. So that's my commitment, my promise.
Terrific. Senator Becker, would you like to leave us with a promise?
Yeah, I promise to keep the focus on equity. Make sure that we get, starting this Saturday, that East Palo Alto, Bellhaven, North Fair Oaks get vaccinated. And it's
Terrific. I'll have to have you just make one sentence. Pastor Baines, would you like to leave us with a promise? Although you're not an elected official.
No, I'm not. My congregation goes beyond that. So I would, my promise is to continue to help educate the brown and, well, people of color, and be that trusted voice that it is something we need to do because our life literally is at stake. So I could
Lisa, a promise?
Yes, we as Ravenswood Family Health Network promise to do everything we can to deliver the best health care, the highest quality, and vaccines for COVID, as long as we can get them and as long as we can stand on our feet.
Thank you, Assemblyman Berman.
Yeah, I promise to keep on, pushing the powers that be, and to keep on advocating for the most underserved communities in my district around COVID and around all other issues.
Thank you, Councilmember Lopez.
And well said. I just want to quickly say that, the RV Safe program that Pastor Baines has helped ushered in is the only one in existence in the whole peninsula. And so East Palo Alto is a progressive champion, but we can't do it without all our leaders. And so I've promised to collaborate with all leaders who are on the cutting edge of change, and more importantly, to ensure that we uphold the principles of the city, which is to help the most vulnerable, not to punish them. And that's my commitment.
Fantastic. Well, I'd like to thank you all for all of the ideas that you've shared with our viewers. And I'd like to especially thank you for all of the promises that you've made that we can now turn around and hold you accountable for. So thank you so much for sharing your time with us, with each other. And we'll be following up with you in the future. So
Thanks, Henrietta.
until then.